Larry Ahrens here, and once again with Dr. Harvey White, conversations about cardiovascular health. Dr. White is the founder and executive director of Vessel Health in Albuquerque, New Mexico. And we've been talking about the vein system. We've been talking about some possible problems with the vein system, varicose veins, some of the health problems that can occur from that. And every patient is different that you see.
Correct.
So evaluation is paramount here. Talk about how you evaluate a vein situation.
You know, Vessel Health is a bit different organization. Not only do we mostly focus on health, but being from the area of cardiology initially, it allows us to take a broader view of the individual, particularly when it comes to issues with their lower legs, to try to make sure, Larry, that the problems that have developed in the lower legs are perhaps not from the heart. And a couple sessions ago talked a little bit about the vein system, which brings blood back to the heart. Indeed, you can have heart troubles that can create venous hypertension, that is excessive blood pooling in the legs. And those can be things like a problem with one of the valves, the tricuspid valve. It can be a problem with the lungs. The lungs, you can have what's called pulmonary hypertension from too much smoking and things like that. Now, there are other opportunities, you might say, for patients to go to look into issues with their varicose veins, but virtually none other can look at the whole system. So, do you want me to go through a bit about how we evaluate that? I'd be happy to.
Please do.
We start from top to bottom. We consider whether an individual needs what we call an echocardiogram. That's an ultrasound of the heart that looks at the heartbeat, the heart valves, and the lungs, the pressure in the lungs. And we try to get that off the table, you might say, as being an issue.
Okay.
Then, if an individual has a problem like ulcers in the legs, those admittedly can in some rare instances be due to the arteries that bring blood down the legs.
I see.
And so we sometimes decide in our office to do an ultrasound of those arteries to make sure that there isn't PAD. And we talked about PAD, okay, that hardening kind of thing, which when there's not enough blood supply can cause an ulcer. So assuming that those are off the table, either by discussion, by looking at the leg, or by these tests, we go on, as most vein evaluations do, and do what's called an ultrasound of the veins in the lower extremities. And I don't know if you know much about ultrasound. Ultrasound, Larry, is used to look at babies in utero, etc. It's sound waves, and we take a sound wave, we bounce it off the blood vessel, we bring it back. And in this instance, we map the veins. And you can imagine looking at your hand, in the back of your hand, the veins are different in everybody. You know? So we have to get a sort of a sense of that, where they go. And then we look to see if that valve that I mentioned is functional or not. Does it let blood back down to the feet instead of doing its job and keeping it back up next to the heart? And we do that in a very simple test. It takes about 20 minutes to do. I look at it, or one of our team looks at it, and we decide if one has an issue that we call venous reflux disease, where there is reflux of blood back down the leg that causes venous hypertension.
I know. People are wondering, is there any pain involved in these tests?
The tests are painless. And that's, you know, they also don't use any radiation. And when we do work on the heart, which is the coronary arteries, and we put stents in, or we work on the legs arteries, we do those in the hospital with X-ray vision. Okay, that is a radiation environment. It's tough on the operator, it's tough, not so tough on the patient, but it's a little different. This is a non-invasive, in-office procedure that lets us get to the heart of the matter, so to speak. That what we do at Vessel Health is we attend to the vein issue, but we're always conscious of broader health issues, and we tend to guide them into healthy lifestyle, healthy eating, exercise habits, et cetera, et cetera. So in a certain sense, the vein issues are important in and of themselves, but they're most important as a portal to get to an individual's global health problems. And we have a tagline at Vessel Health. I haven't even mentioned that yet, but it's treat the system not the symptom. So we tend to focus a bit on the symptom, the problem, always segueing or moving into the system.
If you want to talk to Dr. White, you can call him or visit the website for all the info.
www.vesselnm, as in New Mexico.com, or on the phone, 505-828-3000.
Good stuff, Dr. White. Thank you.
Thank you very much, Larry.